something like acetaminophen. We have elderly patients come in with fractures. We put them on acetaminophen around the clock. And oftentimes when we're thinking of pain, we're not thinking of acetaminophen because it is just a very mild painkiller. But in our elderly population, they're more sensitive to these medications. So we'll put somebody on acetaminophen around the clock and they barely use any opioid medications. So things like that, we can work with, and maybe we don't need as high of doses, and maybe we can avoid some medications that can be harmful or can affect the elderly population by going back to our simple things, going back to our basics, and trying some of those medications like, acetaminophen, and just being careful, like something like our NSAIDs or ibuprofen drugs. We think they're very mild, but they can be harmful to the elderly, and they're actually on the Beers list, which is a list of medications that can be harmful. So just understanding which medications would be appropriate, and also the dosing that we would want to institute in our elderly being lower, as far as that goes.
Even just outside of the elderly, I think what's one of the positives of the opioid crisis is that we're now looking a lot more rapidly for other receptors and other targets and other means of addressing pain, right, and really actively searching very hard to quickly develop things that we can target. And there's a huge focus on function, but also on when you talk to patients, they're like, I appreciate you offering me all these medications, but the challenge I'm having is I still have the underlying problem. So it's like a Band-Aid. So there's also a big focus on the disease states and trying to actually treat the disease state. And for example, Maria and I treat a lot of different sickle cell patients, some of the same ones being not far away from each other in Philadelphia. And so just, to treat that disease state itself helps with the pain syndromes that develop and preventing the development of those pain syndromes down the road. So the actual treatment, there's not a lot of treatment options, but as we are going through, it's exciting to hear more of the focus in the studies that are being done at actual treating underlying diseases, even in things like cancer, right? So now we're doing things like modifying T cells and basically restructuring the whole immune system. And so that's cool because we're actually treating the underlying disease. And so I think with a push away from opioids, while there is an appropriate population for them, I'm hoping and I'm excited for what's kind of to come out of that.